Dr. Gupta did set the ball in rolling. So I'll ask you, why are more youngsters falling prey to hypertension and cardiac ailments?
Well, I think lack of activity is probably one of the major causes that we are seeing in the last couple of years, especially since this whole pandemic took over and people were forced to stay indoors. A lot of people, I mean, we as doctors were probably the only people on the roads at that time, allowed to be on the roads at that time. Probably the right thing to say. A lot of people lost the habit of exercise. A lot of people lost the habit of regular physical activity. You were indoors, you was confined to your thing, and not a lot of us actually, even people who used to do regular exercise prior, used to probably go to gyms, go to parks. Not many people used to do kind of exercise at home, and now that we are more into this apartment culture and confined living spaces where you don't really have the good old days when you had a house with a balcony, or you have a terrace, or a garden where you go and walk. And most of us are living within a 2 BHK, 3 BHK, where you don't have the luxury to have a specific exercise area. People just took it as an excuse to reduce their physical activity, become more sedentary, and then easy access to food delivery apps. Now you're eating more and you're working out less, and you're eating a lot of junk. And you want to eat junk, it's there at the snap of your finger. Within 30 minutes or less, you have it at your doorstep. So this wasn't happening before. Now there's a lot of change in our own diet, our own lifestyle, and that has probably set the ball rolling to many more youngsters coming in. As Dr. Gupta was rightly saying that a lot of times we are seeing patients coming in with young heart attacks, late 20s, early 30s, people with massive MIs. They seemingly don't have any risk factors, yet when they come in, we find their pressures are 170, 180. People who have come with strokes, intracranial bleeds, who have high blood pressures of 170, 180, close to 200 even at times. People who your morbid obesity. The pandemic has led to a lot of sedentary lifestyle, increase in weight. Obesity has contributed to sleep apnea, which is one of the underdiagnosed, even today, one of the most underdiagnosed risk factors for development of young hypertension. In fact, since we actively started looking into sleep apnea in young hypertensives, we were surprised almost 4 out of 10 patients that we looked at in young hypertensives turned out to have some degree of sleep apnea. And these are people who actually do well with lifestyle changes, with the use of CPAP for some time. Their weight comes down, their metabolic syndrome reverts, and then their pressures get controlled. So these are people who probably, if you identify them early and treat them early, change their lifestyle, they come down to a healthy weight, they come down to a healthy build, and they have regular exercise, regular diet. These are the population where you can actually reverse the high blood pressure. Rather than when compared to an elderly whose vessels have already stiffened, the heart has already remodeled, they are people who will be on drugs for life. So that is probably one of the major reasons why we are seeing a spurt in young hypertensives.
Hypertension is described as a silent enemy. How early can hypertension be detected, and what are the symptoms?
Hypertension can be detected. The thing with hypertension, the reason why it's called a silent killer, is close to more than 50% of people who have hypertension don't have symptoms. And unless your pressure crosses 170, 180, 200, when you're developing, signs like headache and occipital, early morning headache, early morning giddiness, people at towards the stages might even come with ocular symptoms, blurring of vision, blackouts, giddiness, falls. Sometimes they can have palpitations, irregular heartbeats. Now, these are the people that you end up detecting. But otherwise, people who have pressures 140, 150, unless they actually go and get it checked, you're not going to be able to detect it. So I think at least in today's day and age, everybody should have a BP apparatus at home. And maybe once a month, you just check all your pressures, because especially if you have risk factors, especially if you're living a sedentary life, if you are a diabetic, if you are a smoker or you have ever smoked, if you're around people who smoke, if you consume alcohol on a regular basis, now if your cholesterols are high, if you are on the higher obese side, or even on the little more of a heavier weight, you should probably be looking at your pressures every month and look at them in both your arms, not just in one arm.